Good morning. Today I'd like to provide a couple of reminders. First, free flu shots are available through the St. Louis County Department of Public Health. Appointments can be made at stlcorona.com. You can simply click on the flu shot scheduling button on our website and can make arrangements for a specific time and date to receive a flu shot at either our North County location in Berkeley or a South County location in Sunset Hills. Getting a flu shot has always been a key part of staying healthy. And getting a flu shot will not prevent you from becoming infected with COVID-19, but it will prevent the flu. And this is even more important than ever in this pandemic, as we want to do everything we can to limit the spread of the flu in our community so that our hospitals will not be overwhelmed, and that every year they receive thousands of flu patients. But it's more important than ever this year to save our hospital capacity for people who become infected with COVID-19. The CDC recommends that everyone over 6 months old receive a flu shot unless there's a medical indication not to. Also today, the new guidelines for youth sports go into effect. With these new guidelines, we are allowing for more youth sports to be played. We urge our athletes and our coaches and our parents to follow the restrictions closely that accompany these guidelines. Physical activity is a vital part of keeping our kids healthy. This includes exercise and all the leadership and team building activities that go along with youth sports. These are skills that are important, and kids will carry them with them until they are adults. St. Louis County continues to balance the importance of this activity of our children with the presence and the spread of COVID-19 in our community. Of significant concern is getting our children back into school and back into a classroom for in-person learning as soon as possible, and as soon as the school districts are comfortable in doing so. These youth sports guidelines serve as an important balance, limiting the transmission of COVID-19 as students get back into school and as they engage in sporting events without impeding the progress as they return to the classroom. We have recommended that elementary and middle school students return to the classroom when possible, but this is not a mandate. It's up to each school district to decide what is best in their school, for their students, for their teachers, and their staff. Our Department of Public Health has set these youth sports guidelines in conjunction, in partnership with other stakeholders, including athletic directors, coaches, and youth sports advocates. Details of these guidelines, which go into effect today, are available at stlcorona.com. You can click on the reopening guidelines at the bottom of the page. The goal of this partnership is to determine the best practices for all who sponsor youth sports in St. Louis County. I'd love to see Friday night football games under the Friday night lights as soon as possible, but we're not quite there yet. The hard work of protecting ourselves and others from this virus is paying off. Currently in St. Louis County, the positivity rate is 4.8%. Compliance with our mask mandates and social distancing has been widely adopted, and it is strong. Our spring, summer, and fall now continue to unfold in ways that we have not seen before. But the diligence is paying off, and we can't let up now. And sadly, we have sober reminders that the virus, the COVID-19 pandemic, is still among us. COVID-19 has taken the lives of more than 800 people in St. Louis County. Over 27,000 of our residents have been infected. These are our neighbors, our relatives, our coworkers, and our friends. Dozens of our St. Louis County employees have been infected. In fact, almost everyone knows someone or has someone in their family who's been infected as well. This is still very real, very contagious, and it will be with us until we have a vaccine. Finally, I'd like to address the CARES Act grant St. Louis County has received from the federal government to help us respond to this pandemic. Of the $173.5 million that we have budgeted, all of it has been allocated except for $10 million. We are sending these funds to the folks who need it the most. That was my commitment when we received the funds, and that will be the priority of St. Louis County. At stlcorona.com, at our transparency portal, you can see where the money has been appropriated and where it's been spent. We are currently working with county municipalities to help them with their public safety budgets and their public safety activities, and to get these funds into the communities to help with these costs. County employees have been working diligently to ensure that the money gets out the door in a responsible manner, and that every dollar is spent in compliance with the conditions set by the federal government. Thank you to everyone. This has been a long 7 months. Let's keep working together. It's the only successful path forward. Thanks, and I'd be glad to take any questions.
So it's my understanding that the county is exploring kind of what the city is exploring when it comes to having school districts kind of lay out a plan when it comes to each individual sport. What could that look like for the county if that does happen?
Well, we have been working with athletic directors, pediatricians, and youth sports advocates to find a path forward for all sports, and we've modified those guidelines moving forward. And we're certainly going to listen to ideas such as a more aggressive testing program, which I've heard has been suggested in other areas. We have to make sure that this takes into account the increased risk of infection in high contact sports. I suspect that it's modeled after what we've seen in professional sports, but we also recognize that those athletes are in a bubble and are isolated, and it's not just the aggressive testing that helps create a program to allow high risk, high contact sports to happen, but it's also the isolation from other people outside of that bubble. So we're going to listen to all ideas. We're very sensitive to these concerns, and we're very sensitive to the enthusiasm and passion and sincerity of the folks that are advocating for high contact sports to be played.
So it's not just a positivity rate number that you're looking at. There's other factors that will play into it if you do change that?
Well, there's a lot that plays into the risk of the sport, and the high contact up close activity is what risks transmission. And that's why we've seen very dramatic steps taken in professional sports for these high contact sports to happen. And that includes a frequent testing program, in some sports daily, but it also includes isolating those athletes in a bubble, social isolation from everyone who's not a part of that activity. So there may be a pathway forward, and we are certainly going to talk about that, and we want to hear what they have to say about a testing environment that may help balance the high risk that some of these sports have. We want to make sure that that testing opportunity is, that we respect that not all schools that have football teams or other teams that other high contact sports like wrestling have the resources to implement a testing program like that. So we're going to be talking about all that, and we will continue these conversations with all of our stakeholders, just like we do in every industry, not just the youth sports industry, but also all sectors of our economy. We have advisory groups that are helping us find a path forward that balances their need for commerce with also the risk of moving COVID in our community. We've taken some very serious and significant steps in St. Louis County to protect our residents, and that's why the transmission rate is lower than other places in the state and the other places in the country. And the consequences of a higher transmission rate are real. When our folks become sick, some of them die, some of them fill up in our hospitals, and some folks are left with serious chronic long-term medical problems like pulmonary fibrosis, myocarditis, and long-term peripheral nerve injury. So we have to recognize that this is a balance. We want to open up our community as much as possible and balance these activities that have some risk associated with them with the spread of COVID in our community and the real serious health impacts of that.
You mentioned that $10 million that you guys have left from the CARES Act will be distributed to local municipalities within.
No, the local municipality reservation is already budgeted, and we have reserved up to $47 million for our local municipalities based on their public safety budgets and other eligible activities according to the federal guidelines. So we're currently receiving applications from municipalities now, and we're processing those applications. And we're going to try and get that money to them as soon as possible.
And so for the 10 million that you had saved, what were you using that?
That's a
for?
reserve. That's just a budgetary reserve. Anytime you have an allocation, you know, of that magnitude, $170 million, we need to save some in reserve. It's about 6%, and that's the historic reserve number for St. Louis County.
That does have to be spent though, eventually.
Yeah, it all has to be spent by by December 30th. Yes. Okay, Doug, you have questions?
You have one question from the call. Do you believe the school district should circumvent St. Louis County health orders by playing football in Jefferson County? And does this endanger the students playing in those games?
Well, we believe that the activities that we have limited in our public health orders are important, and that not following these restrictions and guidelines do endanger the students, whether they play in St. Louis County or somewhere else. So our public health department, and I will follow the recommendations of our public health department and our experts in the medical community who help us develop these guidelines. Their recommendations are these high contact sports should not be played among the age group where the positivity rate is as high as it is now. And so our health department's not recommending that they be played, and they certainly would not recommend that they be played somewhere else where the positivity rate is even higher. Other questions? Okay, thank you.